right. All right. Greetings and welcome to this new Salvation and Social Justice conversation segment where we meet with community leaders, with experts to talk about issues that are critical to the Black church, the Black community, to Black liberation, Black joy, and Black life. And so we look to do this in a quick 20-minute take. And moving forward, we'll be bringing you quick hitting information. Members of the Salvation and Social Justice team will sit down and have candid, informative dialogues with the change makers, and from everything ranging from health equity to police accountability, decarceration, education equity, and reducing the racial wealth gap and more. Today, we are thrilled to start this series of conversations with a good friend of mine, Dr. Poonam Alaigh, to outline some facts and answer questions about the COVID-19 vaccine. We started this candid dialogue a little over a week ago with our panel on the Black church and the COVID-19 vaccine. Today, we want to hear more and add more voices, critical voices and expertise to the mix. Salvation and Social Justice is committed to eliminating barriers to accessing proper healthcare resources and educational tools. And so, sisters and brothers, I have the pleasure of introducing my good friend, Dr. Alaigh, who I met some time ago, working in this very space. And she approaches this conversation from an empathetic posture. She is a mother, a wife, a daughter, and she relates to so many of us in our community. And so, my good friend, Dr. Alaigh, why is this conversation about the COVID-19 vaccine personally important to you?
Thank you, Reverend. First of all, I really appreciate you having me as part of this dialogue. I am honored to be here, and this is a fight. This is a war that we're in. And the more we can empower everyone with knowledge and tools and resources, the better we're going to be able to fight this pandemic. And as you said, I relate to this most importantly as a woman of color. I'm a mother, I'm a wife, I'm a daughter, I'm a sister, I'm a friend. And when this pandemic started a year ago, the tragedy and the devastation that was happening is unimaginable. This is real. And when I look at it from as a physician and a healthcare professional, I just know that we need to equip our people, our communities of color, with better knowledge and tools so that they can be part of not just this fight, but they're safe. And for me, this is really important, Reverend. I've seen patients, I've been in the operational front lines where people come in with maybe a little bit of shortness of breath. They go into the emergency room, and in hours, Reverend, they're leaving just in a few hours in body bags. That's how devastating this illness is. And I know in the beginning, we were trying to understand the disease, and we didn't know how to even treat the disease in the right way. But now we are so much more knowledgeable. We know how to care. We know how to prevent the disease. And it's such an exciting time because it's like landing on the moon. We have a vaccine that will help protect us. And when you look at the statistics, Reverend, it's just so heart-wrenching that our communities of color, Blacks and Browns, are the ones that are paying the price for the devastation. The infection is higher, the death rate is higher. They don't know how to access resources. And rightfully so, Reverend, there is mistrust in the system. So I'm hoping we can talk about this.
For sure. I really appreciate you mentioning this issue of mistrust, right? I would be remiss if I didn't mention how many Black Americans, Black New Jerseyans have had their trust violated. There's a history which we all know well and which resonates. Very good book that documents this history called Medical Apartheid. The experimentation that was done on slaves, particularly Sister Henrietta Lacks, and how everything went down in terms of gynecology and experimenting on her body, the Tuskegee experiments, and how critical information was withheld from folks, the history of how healthcare resources have been taken out of and kept from communities of color, and particularly Black communities. And so this issue of trust is vitally critical. And so with all that being said, in the area of trust, given all of this history, what is your take on the vaccine? Why do you trust it? Why are you making this particular recommendation to communities of color, given the history?
First of all, the Tuskegee tragedy is a true tragedy. It's something that we should never forget as a country, as mankind, as human beings. And to be testing on untreated patients who had syphilis and them not knowing that is one of the darkest moments of our times. And so, our community is well justified not to trust the system. That is what I know. How could you trust a system that failed them so miserably, not only costing lives, but wives and children as a result of those experiments? So again, I pray that, that's something we don't forget so that we never repeat it. So that's the first thing. The second thing, I think as a mother and again, as a woman of color, I too was thinking about like my communities, like my friends and my family had said to me, how can a vaccine that normally takes 5 to 10 years to develop be safe and effective if we've been able to bring it to market in less than a year? And the human side of me relates to that totally, especially knowing what our history has been. But when you look at the scientific side, Reverend, there are a number of things I want to make sure we make very clear in this conversation. This was not a vaccine that was manufactured in a year. There are decades of work that took place to get us to the point of being able to create and discover and manufacture truly an innovation in science and in medicine in the form of this vaccine. So the vaccine is something called an mRNA vaccine. So we have 2 vaccines right now, Pfizer and Moderna. And the vaccine is an mRNA vaccine. What that means is that the messenger RNA is like a blueprint. It's a blueprint of what the virus proteins are. And when you inject the vaccine, it goes into the cells of the muscle that you're injecting it in. It does not go into the nucleus. It does not affect the genetic material in any way. It just goes into the cytoplasm of the cell, and it tricks the cell as though there was an infection because it has that blueprint of what that protein is that's causing the infection. And the cell produces that protein. So it doesn't produce a virus, just that infective protein. The protein then gets expressed on the surface of the cell. And the body thinks that the cell is infected and is producing this protein when the cell was never infected. We tricked the cell into that. And the body produces the antibodies and kills the cell. So even the mRNA doesn't last for more than a few hours to a few days. That's all. And the cells are all destroyed. It's not like it's circulating. It just infects it locally. It produces the proteins locally, but there's a reaction all over the body saying, okay, there's something that shouldn't be here. We're finding something. These are like scavenger cells. They're saying this is not supposed to be here, and it produces the antibodies. And that's how you get the immunity. So if we take a step back, Reverend, the mRNA technique was worked on since the 1990s. And then we had, I'm sure you remember it, we had in 2002 and 2012, two other infections that were happening in different parts of the world. One infection was the SARS infection in Southeast Asia, and the second infection was the MERS infection in the Middle East. They're part of the same family that COVID-19 is. So they're all part of the coronavirus family. SARS in 2002, MERS in 2012, and COVID in 2019. And since 2002, we have been working as scientists to develop a vaccine using mRNA technology. So we were doing it in 2002, we were doing it in 2012. But fortunate for us, the infection in those two parts of the world were contained. So the vaccine was never completed. But everything that we had to learn around genetic coding, how these viruses cause infection, how you would fight the infection, what you would have to do, was all done during that time. And so when we were hit with the infection, and when the WHO declared a novel infection means the first infection of its kind in January. In 10 days in January, we were able to do the entire genetic sequencing because we knew that was going to be important for the vaccine. We had the mRNA technology going already because of all the research that was done since the 1990s and then expedited in 2002 and 2012. And we hit the ground running. On top of it, we had the private sector and the public sector all coming together, government agencies, not just in this country, all across the world. We were all one, in trying to fight this pandemic. We all came together and said, we will put all kinds of resources, the best of our scientists, to be able to do these studies effectively and in large numbers. And we will not do these studies sequentially, but we'll do it concurrently together in collaboration. And all that resulted in efficiencies, and we were able to do something that we as humanity should really, really be proud of, which is creating a vaccine that, based on 74,000 subjects in studies, have shown to be safe and 95% effective at this point.
Wow, that is so powerful. Thank you for sharing that. And that information builds trust. I think about the scriptures which say, my people perish for lack of knowledge. And I also think about to the point that you made about how when the world community, when humanity gets together, that wonderful things can happen. So I think about the scriptures when they talk about the Tower of Babel being built, and God looks and says that when they put their minds to it, and this was a collection of humanity, when they put their minds to it, they can achieve anything. In that instance, they were doing such to do something which was all about themselves. But in the Christian tradition, we see, and God scatters them and divides them because God doesn't want them getting together to just be about themselves. But ultimately, on the day of Pentecost, which we celebrate, it's all about humanity coming back together to be about something bigger than themselves. And so this is what I really hear from a theological framework. And how amazing would it be if the world community got together to work to eradicate many of the challenges that we face? So thank you for that. To bring this really, really down, to put it in terms of some things that folks could walk away with, particularly, are there any populations of people who should not take the vaccine?
So Reverend, it's a very safe vaccine, based on all the information. So remember I said there were 74,000 researchers in the research of people that were tested. Today we have almost 200 million people across the world that have got the vaccine. 60 million of them are here right in our own country. And at this point, I would say everyone can take it, except unless you have had a severe reaction to the first dose of the vaccine, where you had anaphylaxis and needed an EpiPen or needed emergent care. And if you were allergic to any of the components of the vaccine, and the two main components they talk about is polyethylene glycol and polysorbic acid. It's used for bowel preps like Go Lightly and all, not very common. But if you have any concerns of allergies, then talk to your physician. But other than that, everyone can take it. Now, if you have a fever, there are some instances where you may have to delay getting the vaccine. So if you have a fever of more than 100.4, or you've had a recent COVID infection, you want to make sure that you're clear before you can get the vaccine. If you've had COVID where you needed the convalescent plasma or monoclonal antibodies to get treated, you have immunity for 3 months. And so you don't need the vaccine within those 3 months. And then after that, you should talk to your physician about what the right timing is to be able to get the vaccine.
Great, thank you. Can you talk a little bit about the vaccine in relation to these new variants and also herd immunity?
Oh my gosh, Reverend, and I just always love listening to you when you put in the context of our world. But when you talk about humanity coming together, there's no more powerful example than herd immunity, and that's exactly what we're trying to do. We're trying to bring the entire world together so that we all have immunity as one unit. And for that, it's really important that we get vaccinated as soon as possible, as many people as possible. And even with the variants that are out there, the vaccine is effective. It may not be the 95% effectiveness that we see in the original strains, but it's still effective enough to be able to fight, from what the data is showing, severe disease. And that's what you want to prevent. You want to prevent complications and severe, consequences of an infection, and you want to prevent death. So given the situation that we're in right now, the vaccine is effective against the original virus and less effective, but still effective enough to prevent severe disease against the variants. And the only way we're going to manage the variants is if we all get vaccinated as soon as possible in large numbers. Because when we get vaccinated, Reverend, the virus does not have a place or a host or a human being to infect. When the virus does not have a place where it can infect, then it doesn't have the chance to mutate and cause variants. And so it contains the infection and it stops the infection and the virus dies on its own when it has no place to infect, no human beings to infect. So herd immunity is really, really important. This is a war, and every person has to play his or her role in fighting in this war. In the beginning, in the early part of this war, the only thing we had was masking, hand sanitizing, and good hygiene, social distancing. Those were the things that we were doing. Right. Now we have something that is so much more powerful. And believe me, Reverend, like when I first, again, before I put all these facts together, I too was thinking honestly whether I should wait to get the vaccine or whether I should just jump and get the vaccine. But once we methodically put all the facts together and looked at the data and looked at what the studies were showing, it was, and again, it's based on knowledge. So once you get that, then your comfort level is so much more, is so much better. And at the end of the day, it's riskier to be out there without the vaccine and getting COVID than having the vaccine and being protected any day.
Wow, thank you so much. So it is is so critical. Speaking to everyone who is watching this right now, it is so critical that we are informed so that we can make informed decisions. Far too often, you know, we allow our fears and rumors to keep us from very desperately needed information and cures and healing. And it's understandable why communities of color are often in this place, because that's a defense mechanism. But oftentimes that can work against us. And so, sisters and brothers, everybody who's watching, please, the piece I just want to stress is that, you know, I too, early on, I said, I need to know, I need to learn. And one of the reasons we're presenting multiple times and with experts in this area, I don't even think I can properly pronounce and repeat the various ingredients that Dr. Alaigh put forward. I don't know, I don't understand what they mean. And therefore, I want to seek out the folks who do understand what that means, and folks that I know, that I trust, so that I can learn and make an informed decision. The same way, Dr. Alaigh, that I say to many people, you may not understand something theologically. You may have a book in front of you that none of the words make sense. But if you know me and you trust me and you present it to me, I can tell you what it means and break it down to layperson's terms for you. And you may trust that I am trying to give you the best of what I know. And that is what I have done, to be informed by medical experts, by scientists that I trust, and therefore pass that information along. So truly appreciate that. I just want to ask one final question. We've heard a lot about contracting the virus, and you know, a lot of folks I've heard say, "Well, I've had it already, so now I don't need to get the vaccine because I'm immune now." And so two questions: should folks still get the vaccine if they have had COVID? And finally, can people still get COVID if they have had the vaccine?
Great questions. And I always say that, you know, we're at a time almost like we're building the plane and flying it at the same time. It's a, you know, it's a new infection, and we're learning more and more about this infection as we're dealing with the infection and the pandemic. And so if you've had the COVID infection, you still should be getting the vaccine, as long as, and if you've had, as part of the treatment for the COVID infection, you've had monoclonal antibodies or the convalescent plasma, then you can wait for 3 months before you get the vaccine. Otherwise, if you're, you know, about, you know, 2 to 3 weeks out and you're at high risk, I think you really should be talking to your physician, and you should still be getting the vaccine. How long the immunity lasts, whether it's natural immunity because of the infection or because of the vaccine, is something that we're still evaluating. We do think that the immunity lasts for at least 6 months. Based on other coronaviruses, you know, we have data that shows immunity can last up until 2 years. But all these studies are still happening in terms of knowing when the next booster dose should be given after the initial vaccination. So those things are things that we're going to be able to get informed on based on data collection in real time. But again, Reverend, I just, the one thing I want to continue to focus on is, I was hesitant about the vaccine when I first heard about Operation Warp Speed. I wanted to know more about it. You know, our communities, as you said so eloquently, is based on trust and love and faith and prayer. And we haven't been treated, you know, with that same respect. Mm-hmm. And so there's a good reason for us to feel like we're feeling at this point. I know that in many communities, it's a fatalistic attitude where if it's going to happen, it's going to happen, and I'm going to deal with it, right? I don't even know if it's real. But I'm telling you, it is real. And I want to just tell you a quick story from a friend of mine who runs a big hospital. And I've said to him, I'm going to use that example when I talk to different people because it's so powerful. But he runs a hospital in one of the boroughs in New York City. And he says that the number of people that are coming into the emergency room that are of communities of color is alarming. They're the ones who are on daily wages. They're the ones who cannot stay home when they've been exposed or quarantined. If they don't go out to work, they're the ones who will not put food on the table. They're the ones who are living in multi-generational homes because we're just so family-centric, right? Yep. They're the ones who will continue to work even if they're not feeling well. And what ends up happening is that they're ending up in the emergency room in much more advanced disease. Mm-hmm. And so the chances of complications and death are much higher. Mm-hmm. And he said, like, I wish I could take our community and walk the halls of this hospital and show that this is real and how important it is to take care of yourself and use all of the public health measures and get the vaccine, because there was a time that in those hospitals, there were more body bags than patients in bed. They had no places to put the body bags. So we've come a long way and we can prevent all this. And, you know, we see other parts of our community doing so much better. We should be doing so much better. We should be relying on each other. We should help, you know, answer those questions. We should look at reliable sources to get our information. You know, Reverend, you're such a strong voice here and so well respected in the state. It should be your voice. It should be voice of, you know, healthcare professionals that give the right information, not through Facebook and social media of what could potentially happen. Now, when you get the vaccine, are you going to get sick? Yes. Many people get sick, right? You're going to get soreness in the arm. You may get low-grade fever. You may get chills. You may get body aches, but that's good. That means your immune system's working. You're not getting the infection from the vaccine. Right. There's no way you're getting the infection. So I just, you know, we have to band together and we have to be there for our people, Reverend.
Right. That's right. Thank you so much. Thank you so much, Dr. Alaigh. Any closing pointers, remarks, information that you want to give the people?
I think I'm there for you and for the community in any which way I can help to help clarify questions. So I just think I'm very, very optimistic. It's our communities that have always stood up to the challenge and we've always succeeded, but we have to create that faith and trust amongst one another to be able to do that.
Thank you so much, Dr. Alaigh. Thank you, my friend. Sisters and brothers, thank you for joining us for this quick community conversation on something so critical as we all are learning and making an informed decision so that our communities, Black and Brown communities, can benefit, can have life, and can thrive. The prophet Jeremiah put it this way, asked the question, is there not a balm in Gilead? And if not, then why is there no physician there? And if not, then, and if so, why are my poor people not healed? And so there is a balm in Gilead. There is a solution. There is a cure for this COVID-19 situation. And so therefore, let us seek out the balm. Let us seek out Gilead. Thank you so much, Dr. Alaigh, for all that you do for our communities. God bless.
Thank you. God bless. God bless. Thank you.